So hello, everyone. I'm Nikki Conti from the Massachusetts Health Connector. And again, want to thank you for joining today's presentation, Health Connector for Business, Affordable, Flexible Health Coverage. As I have already said, we have a number of participants who've signed up, but we want to be respectful of your time in the 12 o'clock start. So I'm going to be facilitating today's session and also presenting a portion of it. And I'm joined by my colleagues, Thalia and Nina. Thalia will be giving a good portion of the presentation. And then we, with Thalia, myself, and Nina, we're going to be here to help answer any questions you might have. Before we get into the details of today's presentation, I just want to take a moment to thank chambers, business organizations, and brokers across the state for their support in promoting today's webinar. And also want to give any attendee just some information about the presentation format. So you'll notice that everyone's audio has been muted and video has been disabled. The presentation portion is going to last approximately 30 to 40 minutes, and then we'll have time for questions and answers at the end. If you want to ask a question at any time, please use the Q&A functionality down at the bottom. We're going to be monitoring your questions throughout. And when you're typing your questions, we just ask that you do not disclose any personal information or protected health information when you ask your question. We're not going to be able to answer those types of questions in full detail on the webinar. But if you do have a specific personal scenario that you want to discuss with someone, we'll be providing contact information for the Health Connectors customer service centers and instructions on how to find free help from either a local certified broker or a navigator. Also, we are recording today's webinar, so following today's presentation, you'll get an email with the presentation materials, so there's no need to take detailed notes. So with that, I just want to thank you for joining us, and I will turn this over to my colleague, Thalia, to get us started with today's presentation.
Okay, hi and welcome everyone again. Our presentation today will be mostly focused on the Health Connector for Business platform, where Nikki and I will go over some of the Health Connector for Business basics. Some of the things that will be covered today is how to get started, savings through comparison shopping, our flexible choice model, details on the ConnectWell program, and the small business health tax credits. And then we'll go through some information on the Health Connector for sole proprietors and owner-only businesses. So for those of you who are less familiar with the Health Connector, we are the state's health insurance marketplace, and we offer affordable health insurance to individuals, families, and small employers. For those who are sole proprietors or owner-only businesses, you can get health coverage through the individual and family side of the Health Connector. Those who qualify are individuals who don't get insurance through their job, a spouse's job, or a partner's job, or who do not qualify for MassHealth. Those who apply on the individual and family side might also qualify for help paying for their coverage. Our presentation today is focused on health insurance coverage, but the Health Connector does also have dental plans available separate from our health insurance plans. And lastly, we have health insurance coverage for small employers with 50 or less full-time employees through our Health Connector for Business platform, which will be, again, the main focus of today's presentation. So the Health Connector has multiple plans available. All the health plans on this slide are sold through the Health Connector and meet state and federal coverage standards. What that means is that all the plans offered by us will cover prescription drugs, visits to the doctors, and other regular medical services. You may qualify for a plan with advanced premium tax credits that could help to reduce the cost of monthly premiums. We also have connector care plans for individuals and families in lower income ranges. These plans use state and federal funds to lower the cost of your premium. There are also catastrophic plans available for those under the age of 30 or with a hardship exemption. And as mentioned before, we have dental plans available through the Health Connector. And then we have Health Connector for Business, which provides insurance to small businesses with less than 50 full-time employees. Okay. So on this slide, you'll see all the lead Massachusetts carriers who offer health and dental coverage to Massachusetts residents through the Health Connector. Having multiple carriers available on our marketplace will hopefully help assist employers and employees to choose the plan that best fits their needs. Towards the bottom of the slide, you'll also see the 2 dental carriers that are available on the Health Connector's platform. Okay, so in addition to the individual and family side, we also have Health Connector for Business. There are a few requirements in order for that people need to meet in order to get coverage through Health Connector for Business. The first requirement is group size. Your small business will need to have between 1 to 50 full-time eligible employees. Groups need to have at least 1 non-owner, non-family member enrolled as an employee, and the business needs to have a physical address located in Massachusetts. Those are some of the main requirements for small group coverage, but once a group is actually enrolling into coverage with the Health Connector, there is a participation requirement. The group must have at least 75% of their full-time employees take action. That action could be either waive their coverage or decide to enroll in the health coverage that is being offered by their employer. There is also an initial binder payment that must be made, and that is due on the 23rd of the month before coverage can begin. This will ensure that your coverage becomes active with the carrier on the 1st of the following month. Okay, benefits of the Health Connector. So there are some great benefits with Health Connector for Business platform, both for employees and employers. This platform allows for small employers to offer health insurance to their employees. This platform offers flexibility, choice, and savings. And I'll go over some unique reasons why an employer might choose the Health Connector to provide health insurance for their employees. First, we are a one-stop shop. As shown in a previous slide, we offer plans with the leading health insurance carriers in the state of Massachusetts. It is the only place where an employer can shop and compare plans in one location. Second, we have competitive premiums that help small businesses save 20% on average. Our easy online quoting tool and having all these carriers offering plans on our platform allows for easy side-by-side comparison. You'll also be able to save money with our wellness rebate program. This program is called ConnectWell, and we will talk a little bit more about that in detail in another slide. Another way to save money would be through our flexible employee choice model. This allows for an employer to set a budget plan. This will allow employers to control their costs, but also allow their employees to have some flexibility in their choice for a plan. There is also free certified assistance for employers. There are over 500 brokers who are available to help employers decide which plan options is best for their business. There are also no membership fees or dues for using Health Connector for Business. And lastly, you will have peace of mind knowing that all the plans offered through the Health Connector for Business platform follow state and federal compliance laws. Okay, so again, all of the plans offered by the Health Connector are compliant with state and federal laws. The plans that we offer go through a seal of approval process to make sure that you and your employees are getting a comprehensive range of benefits that are shown here on the screen. Just to list off a few: emergency services, newborn care, prescription drugs, and mental health and substance use treatments. Additional Health Connector for Business plans. Some features that I would like to highlight are our HSA health savings account plans, our PPO plans in the case that you have employees who live outside of Massachusetts. We'll go over how you'll be able to offer these plans to employees in a later slide. And then new to 2025 is the PVP flags. PVP, which stands for Premium Value Plans, will allow shoppers to identify the lowest cost plans in their regions when searching and comparing plans. All right. So how can you get started with Health Connector for Business? So we do have open enrollment each month, and there are a few deadlines for the Health Connector for Business platform. By the 10th of the month, employers will have to select a benefit package for their employees so that they can open enrollment for them. Once you pick a benefit package, your employees will have the opportunity to explore their options. They will have until the 20th of the month to complete shopping. And as mentioned in a previous slide, before coverage can begin, you'll need to make that initial binder payment by the 23rd of the month to make sure that the carriers are getting their payment on time, and coverage for employees can begin on the 1st of the following month. Again, these deadlines are the same for every month for small group coverage. Okay, we will always encourage small groups to consider using a broker to assist them in selecting a plan. They are free to use for business owners. The Health Connector compensates brokers to assist business owners in selecting and understanding the Health Connector offerings. They will be able to provide you with a quote tailored to your specific business needs, and they'll be able to answer any questions that you might have. They're also available to help you through the plan year, not just when selecting your plan. They're available at the time of renewal, if you have any COBRA questions, or during a special enrollment period if you have any questions about that. And ultimately, they're just a great resource for you to use and to help business owners save time when selecting a plan, because we know that it could be a little bit overwhelming. Okay, so now we're going to go into our employee choice models. We previously mentioned that the employee choice model. This is a unique way that the Health Connector allows employers to provide insurance to their employees. The goal is to control cost for employers while also providing multiple insurance options for their employees. On the employee side, they'll be able to easily compare options and choose plans that fits their needs. We understand that health insurance is not a one-size-fits-all. So we have 3 benefit models that we use on the small business platform. One plan is one you might be familiar with. In the scenario, the employer will pick one plan. The employer will choose the plan and the carrier. This would be the only plan offered to employees. It will have a composite billing method, meaning it will have a fixed rate set for the entire plan year, and it will be taken from an average of all those who have enrolled in your plan. If you have an employer who would like to offer a bronze plan, you would have to select this plan model, one plan, as bronze plans are only offered in this choice model. We also have one carrier, which works a little bit differently. So in this scenario, employees will pick one carrier, for example, Tufts Direct, and from there, they will choose a plan level that they will contribute to. This is called a benchmark or a reference plan, but employees will have the options to choose any available plan with Tufts at whatever metallic tier they want, depending on their needs. So they can choose a platinum, gold, or silver as long as it is with that carrier. Billing for this model will be different for all employees since rate is based on their age. And PPO plans are available in this choice model if you have employees who live out of state and need a national network. So please keep that in mind, that the carrier will need to offer, please keep in mind that the carrier will have to offer PPO plans. And then next we have the one level, which works in a similar way. The difference being that the employer will select between a gold and silver tier, and employees will have the choice of which carrier they would like to go with. Again, employers will have a benchmark or a reference plan that they will contribute to, but employees can select any plan that they would like as long as it is within the level that they selected. And this plan is great if your employees just have different network needs. And now I will pass it to Nikki so that she can go over the ConnectWell and all its features.
Thanks so much, Thalia. And again, thank you, folks. So Thalia mentioned ConnectWell already, so I'm going to go into a little bit more detail about this opportunity. This is one of our favorite programs to talk about, in that it is real. It is, I was going to say, it is real. It is legitimate. Employers can receive a 15% rebate on their contributions towards premiums for the year if a percentage of their employees participate in wellness activities. So this is a little bit outdated here. We've got some rates from 2023, but you can see that the ConnectWell rebate for this employer was close to $5,000. So in this program, employees who participate earn a $100 gift card for participating in what I'd like to say a really low lift wellness activity. And the employers are, benefiting in a number of ways. They're benefiting with their rebate, and then they're also benefiting from, a little bit of a culture, I don't know, I don't want to say shift, but a culture opportunity for folks to participate in a program together. So going on to the next slide, I'll talk a little bit about the activities themselves. So there are over 35 different approved wellness activities. So they're not all physical activities. There are things you can choose from categories such as mind, body, money. So as examples, if an individual decides to volunteer or takes a meditation class, or let's say they decide they go to the doctor and they get their well visit. These are all included as part of a ConnectWell activity. The person can get credit for doing that activity, and then that does in fact count towards the employer's quota for getting 33% of their staff to participate. So it's a really good way to save additionally on your premiums for the year as a small employer. So going on to the next slide. So this process, we're trying to make this process as simple as possible for both the employers and the employees. So if your group is eligible, you are automatically enrolled and emailed 10 days after the plan starts. And then the employees get an email from us and we talk about the incentives and give them descriptions on how to participate. Then the employees just need to complete their activities. They have to submit a proof that they've completed one of the approved activities, but essentially it's very straightforward. Then they're going to get a $100 gift card. And once you have reached 33% participation, you as the employer will, first of all, you're going to receive updates about your participation rate, so you can certainly encourage your employees to take part. But once you hit 33%, you are eligible for that rebate. And at the end of the year, you're going to get a check, a real check. So yes, I like talking about that photo because we took that. I mean, I was there actually taking that photo that day, and the employers are very happy with this program. On to the next slide, I want to talk a little bit more about another opportunity for savings. And this is at the federal level. The wellness program is a state program, But the small business healthcare tax credit is an opportunity where a small business might be eligible for up to a 50% tax credit if they purchase coverage through the Health Connector. So I mentioned this is at the federal level, and it's meant to ensure that individuals buy coverage or employers buy coverage through the marketplaces. And we do not manage this program, but rather it is managed by the federal government. And you have to be enrolled in Health Connector for Business. You have to cover at least 50% of the cost of a single healthcare coverage for the employee. It's limited to businesses that have fewer than 25 full-time equivalent employees, and their wages need to be less than $62,000 a year. So we don't, as I said, we don't manage this program. So really just encourage anybody who thinks, when you think about the type of business that you're operating, the type of small company you have, if you think, well, wait, this could be something that it would be helpful for us to look into, we would encourage you to talk to either a CPA or, your tax preparer and just learn more about the small business healthcare tax credit. And again, it is only available to small businesses that buy coverage through their state's health insurance marketplace. All right. In this section, we like to just give you some real life examples of around what people are experiencing when they do get health insurance coverage through Health Connector for Business. So we see a lot of ways in which people save on average by shopping through HCB. And this is all before any rebates they get. Ultimately, we are seeing these savings because of the level of choice that individuals have. You'll see that people are able to purchase different levels of coverage, whether they're buying platinum, whether they're buying silver, etc. And you'll see that people are, in fact, the companies are in fact saving dollars here when compared to looking at plans that are purchased off exchange or outside of our marketplace. Okay, so the Leah stepped through all of the different plan models, if you will, in all of the ways that you can consider offering a more flexible experience for your employees. So again, want to just hit these main points, like why, if you're going to be shopping for health insurance coverage, why would it be a good idea for you to look at the Health Connector for Business plans for you and your team? So the first reason truly is the flexible choice models, the employee choice models. These flexible choices let your employees shop for different plans that fit their needs. And it keeps your health, your contribution to those costs consistent. So that is, one reason why we think so many of our employers and employees are happy with the plans that are offered and the plans that they get enrolled in. Also, the Connect Well program, which I discussed a little bit. So if you have less than 25 enrolled employees, you could be an employer that is eligible for that 15% rebate. As I said, the money is real. There is motivation. There is that $100 gift card that your employees will get after they complete that wellness activity. And really, all we need to do is get a third of your employees to participate, and you can see that rebate. I've mentioned briefly the small business healthcare tax credit. As I said, this is a federal tax credit, and only businesses that get their coverage through a state marketplace they are eligible for this. So certainly, if you think you might fit into those categories that I described, you think your staff and their salaries may fit, I really would encourage you to talk to your tax preparer to better understand what the current requirements are, what the current income limits are, and see if that's something you can take advantage of. And then lastly, I know the Leah talked about this, but really, really important to the small business owner, there are no fees. There are no membership dues to enroll in a plan through Health Connector for Business. You simply just get to shop for your coverage options, and you can also seek the support of a certified Health Connector for Business broker. I think what's really important to stress about the brokers, I know Leah spoke about them, but again, just want to reinforce this. Individuals who are certified as a broker to sell Health Connector for Business, they're licensed brokers in Massachusetts first. That's, of course, the first threshold. They are certified licensed brokers. Then they go through an additional training with the Health Connector to better understand these flexible choices, better understand the wellness rebates, direct or guide people on the tax credits, etc. So again, brokers are a great way to take advantage of Health Connector for Business plans because we really understand that small business owners have so much else going on that if they can rely on an individual or a group to help them with this process, we know that it's valued. Going on to the next slide, I'm going to shift gears a bit. So both the Leah and I covered the Health Connector for Business platform. And again, it's for those employers with 50 or fewer full-time equivalent employees. Now, we have a sense that some of you out there might be a sole proprietor or owner only and be wondering, okay, I don't meet those Health Connector for Business requirements. What other coverage options do I have? So I'm going to step through these slides with you and talk about Health Connector plans for individuals and families. And that's essentially how a sole proprietor or owner only is going to get coverage. So you may be eligible for advanced premium tax credits, and these lower the premium amount you pay each month. And as an individual, as a sole proprietor, you're not going to, wait for a check, etc. Simply, you are going to pay the lower premium, and the IRS sends your tax credit directly to the insurance company that you're enrolled in. So you just simply pay the lower premium each month. Now, when an individual or family is looking to see if they qualify for tax credits, they're going to find out that if they qualify, they're going to find out what amount of money they do in fact qualify for. And it's important to note that when you see that number, you actually, if your business fluctuates, let's say the income that you derive fluctuates month to month, you can actually say to yourself, okay, I want to reduce my tax liability. Even though this says I qualify for $500 a month, I might only want to apply $400 a month to the premium just to, hedge my bets, let's say. So it's something to keep in mind. These are tax credits. Now, there's another program with other eligibility requirements, but it's really important for those of you who maybe are just starting your business, getting things off the ground. You might find that you qualify for our Connector Care program. And that program uses federal and state dollars to help reduce the premium amount that you pay each month. In addition to that lower monthly premium, you also have low out-of-pocket costs and you have no deductibles with these Connector Care plans. So depending on your household income, you could choose a plan for as low as $0 or up to $264 a month. And we'll provide you with details on current Connector Care premiums and more resources in the follow-up email that we share with you. All right, so one thing you do need to know about applying as an individual or family, if you're a sole proprietor or owner-only company, is we do have open and closed enrollment rules. So we have closed enrollment, and that actually, our closed enrollment began after, it actually began on January 24th this year. So we don't want you to feel that if you are in need of coverage that you have to wait. We really just encourage individuals to apply for coverage to see if they qualify for a special enrollment period. So for all Health Connector plans, they all start. So whether you're getting a Health Connector plan through a Health Connector for Business or on the individual and family side, all plans start as early as the first day of the month after you enroll. So we, again, because we don't want to discourage you if you need coverage, you want to also just understand that sometimes, depending on your situation, you might find that you qualify for MassHealth, which has different rules, different eligibility rules, and different start dates. So if you need coverage, simply apply. Now, the process for applying as an individual or family member, you need to be someone who lives in Massachusetts. You need to be a U.S. citizen, U.S. national, or otherwise lawfully present in the United States. And you have to be someone who doesn't have an offer of affordable health insurance coverage. Those who shouldn't apply, if you are already enrolled in Medicare, already enrolled in MassHealth or any other public health coverage, let's say like a veterans benefit, no need to apply because you are offered some type of affordable comprehensive health insurance. Also remember, if you have that offer of affordable comprehensive coverage from an employer, either through yourself or your spouse, or if you're incarcerated, you should not apply. You're not going to be able to access coverage. All right. So what are the things you need? Really, you need a Social Security number for everyone who's applying, if they have one. For anyone who's a non-US citizen, you should have your immigration documents handy. And you can learn more about immigration documents from our website. I think the links for some reason are not displaying on these slides, but not to worry. We will make sure the links are showing when you get a copy of this presentation. You will need copies of last 2 pay stubs, unemployment amount. We're going to ask you questions about, or the application is going to ask you questions about income, so it can determine what in fact it is that you qualify for. Now, if you're if you're an owner only or sole proprietor, you really want to give us information about your net income from self-employment. Now, on the individual and family side, if you don't have all the information above, just provide us what you have and we will send you a letter asking for more information if we need it. And again, we will provide you with links and more information in the follow-up email. And of course, during our Q&A. All right, so this slide is important in that we have separate customer service centers for individuals, families, sole proprietors versus Health Connector for Business. So the Leah covered Health Connector for Business, but if you're a sole proprietor and you need some support, you can call Health Connector customer service at 877-623-6765. They can assist you. And even if you've already started the application process, you can give them permission to pick up wherever you left off. They are there to help you. In addition, we have trained and certified people in the community. They're known to us as navigators and certified application counselors. And these folks are available, and many of them speak additional languages. So they can help you figure out where you are in your application, your enrollment process, and even answer questions after you become enrolled. So if you need assistance with the individual and family side, on the broker side, on the Health Connector for Business side, you would be outreaching to a certified broker. But if you are a sole proprietor and you're like, you know what, I could use some support in this area, you can look to our search tool and you can see where free help is available near you. Going on to the next slide. I'll just go through some of these, but Dalia, feel free if you want to jump in, because I think I want to point out like what is the same and what is different between shopping as an individual or shopping as a small business. So just a reminder, a key takeaway, we have Health Connector for Business, again, available to small businesses with 50 or fewer employees. Remember that small employers and owners that don't qualify to offer coverage on Health Connector for Business, they're able to go to mahealthconnector.org, and that is for individuals and families. Now, some of our deadlines are the same. So individuals need to apply for, enroll, and pay their first premium by the 23rd of the month before coverage can start. So as an example, if somebody enrolls and pays by March 23rd, their coverage could begin on April 1st. Now, people also have the opportunity to choose the second month when they are going through the process. So some people, of course, like to be ahead of the game, and that's great. So just keep that in mind. Somebody doesn't have to choose the coverage and have it start immediately. They can actually postpone it a month. Now, for small business employees and owners that do qualify to offer coverage on Health Connector for Business, these are the deadlines that Dalia went through before. So on the 10th of the month, that's the deadline for the employer to create the account, update all full-time employees, quarterly wage documents, and publish the benefit package. This starts the Health Connector for Business open enrollment in the employer online account. Now, you've got 10 days, or rather your employees have 10 days to create accounts and enroll in or waive with the waive coverage with the valid waiver. And then the 23rd of the month, again, same deadline, is for employers to make the first initial binder payment in the billing portal. So going on to the next slide, we are ready for questions, and I do see a couple in the Q&A box, so I am going to turn to both Valia and Nina, and let's see what we got for questions. Okay. So the first question we got is from someone who's asking about being a licensed broker. They want to find out how they can list themselves in the broker directory. And I think someone might have provided them an answer, but either Nina or Thalia, do you want to talk a little bit about how a broker can become a certified Health Connector for Business broker?
Yes. First, the broker must be licensed in Massachusetts, and then they have to request a certification on our website. I did provide the link to this broker so they can submit the request. Once they submit the request, we'll send a follow-up to them, letting them know how to create the account. And once they create the account, we'll send additional forms that they need to complete before we can officially certify them.
Okay, great. Thanks so much, Nina. Next question, I'm going to ask you, but I might need some help dissecting a little bit, Thalia. This individual wrote, when calculating income requirements for Connector Care, does investment income count towards qualifications, specifically from a loan secured by an investment or stock?
I would like to say yes, it does count towards your income. I see the question in the chat. I can go ahead and send the link that lists all the things that you should include as your income. So I'll do that now.
All right, great. Thank you so much. I appreciate that. Next question. Nina, I think this is for you. Can you help us define can you just define the full-time employee? Like how many hours a week is full-time? Do we have a tool that like somebody can use to do that?
Yes.
To figure out?
We do. So it is based on the IRS's definition of full-time, which is 30 hours or more, on average. And you do have to count the full-time equivalent employees when determining the size of your group. I can share the link for that calculator. Once you use that calculator, you'll enter all your full-time employees, and then you'll enter the amount of hours of your part-time employees to determine the number of full-time equivalent employees that you have within your business.
Okay, great. Thank you so much. The next question, I think we covered this, but I think it's good to just remind people. The question is, if someone chooses to use a broker, do they get a commission, and how much more does it cost the employer, the company? And that's either Nina or Thalia, whoever wants to take that.
I can take that. So brokers do receive a commission. However, the broker is at no cost to the employer. So the employer does not pay anything to utilize a broker on our platform.
Okay, great. Next is there an amount of time that an employee has to be employed with the company before they're eligible for health insurance?
Yeah, so the employee has to be considered an eligible employee before the group enrolls into coverage. So if the group is looking to enroll for July 1st, this employee has to be on payroll as of June.
Okay, so I'm so sorry. My
Sorry.
mind. So one more time. So if the person's trying to get coverage for July 1, they need to be on the payroll the month prior.
Correct, yes.
All right, thank you so much. All right, next question. This person writes, they already have coverage through the Health Connector for individuals and families. It sounds like enrolling as a sole proprietor might be more advantageous for me. Do I need to wait until open enrollment in November to switch over? Thalia, I'm going to let you explain this just because I covered that section. I think it would be nice to explain it from a different angle.
Yep. So basically, it's kind of the same thing. If you are already getting coverage through the Health Connector on the individual and family side, it would be the same thing as signing up as a sole proprietor. We kind of just use that during this presentation to just let sole proprietors know that they can get coverage through the Health Connector. It would just be on the individual and family side. So it's basically the same exact thing.
Yep. So same exact set of plans. If you had enrolled through Health Connector Individual and Family and you qualified for advanced premium tax credits, it's the same application. Great. All right. Next question. Are monthly payments from the business employees removed from their payroll, or must the employee pay individually?
So I'll take this question. So we do not bill the employees directly. We will bill the employer the total amount per month. And what the employer will do is set up the deductions on their employee's payroll for the employee portion of the plan, either health or dental.
That's great. Let's see. Okay, this is a great question. So what happens when you hire someone after the rest of the group has enrolled? Can the new employee enroll for the following month?
Yes. So the employee can enroll for the following month. It would be considered a qualifying life event. This person would be considered a new hire, which will provide them a special enrollment period to enroll outside the group's open enrollment.
Okay, great. And I think maybe something I wish I had said, for individuals and families, we have open enrollment, we have a closed enrollment. There is no open or closed enrollment for small employers, right? Like it's rolling enrollment whenever people need coverage. But you are also saying if that employee just started, that is considered a qualifying or a special enrollment qualifying life
Special,
event. Okay,
yes, correct.
great. Next question. If I have coverage already on the Health Connector, can I switch over to my employer's new plan? And the answer is yes. So if you are, let's say you are an individual and your employer wasn't able to offer coverage before, and so you enrolled through mahealthconnector.org for yourself and your family, but now your employer is like, oh, this is great. I want to, your employer is able to offer the coverage. You can just cancel the individual and family coverage and enroll. And actually, you can and you should, because now you have an offer of employer sponsored insurance. So, yes, it is a fairly simple process. It isn't an automatic process, but it's as simple as calling customer service and letting them know that you need to cancel the coverage for the end of the month because you are enrolling in new employer sponsored insurance. Great. And I think, folks, I've never been in a situation like this where we have extra time, but we have extra time. So, folks, please don't be shy. If you have any questions, we're here to help. But this was, I feel like we got a lot of really great questions so far. Right. Are you folks seeing any other open questions? All right, we'll give it a minute. I know on other different webinars I've been on, every time I say, okay, we're going to wrap it up, someone always says, wait, wait, wait. But again, before we do wrap up, you will get an email. You'll get a follow-up email. You will get the presentation. You will get a link to the recording. And then we also send you some additional links. As I said, I know some of the links weren't showing up on the screen, but you'll have links to all the relevant information. All right, so a couple more questions just came in. So what percentage on Health Connector for Business, what percentage of an employee's premiums do employers typically pay? So Nina, can you help us with that?
Yes. So the federal SHOP requirements require employers to contribute 50% for employee-only coverage and a minimum of 33% towards dependent coverage. That is for majority of the year, but in January, for January enrollment, that is waived, that minimum contribution amount. So employers can contribute whatever they like for January, but for the rest of the year, it is 50% for employee only and then 33% for dependent coverage.
Okay, great. Thank you. A couple more came in. I feel like maybe you answered this a bit with this last question. Can you explain a little bit more about eligible employees and minimum employee? Well, no, this is different. Explain a little bit about eligible employees and minimum employee enrollment.
So for the eligible employee requirement, this employee has to be a W-2 employee. They have to work uh, sorry, they have to be considered an employee of this business, and then also file their income based on the state and federal tax requirements. So that would be considered an eligible employee. We do not count the owner, their spouses, or their dependents as eligible employees. We also do not count temporary employees, contractors as eligible employees as well. In regards to the minimum employee enrollment, that is another federal requirement, which is, well, for the state of Massachusetts, is 75% of the employees listed on your census. And that means either the employee waives or enrolls into the coverage that's being offered. And you just have to meet the minimum of 75% for that enrollment.
Great, thank you, Nina. All right, so I have a question here, and I'm wondering if we can maybe share a link for this individual. This person's writing that you mentioned that an employer, sole proprietor, goes through Health Connector, the individual and family platform. But how do I know if I got got the tax credit, if my premium is still over $800? So when somebody applies through the individual and family platform, if there actually are two applications, if you choose right off the bat to not find out if you can access savings, it's a shorter application, but you are only shopping for you're shopping for plans, but you're shopping like full costs that you would cover. So I think that's really important to call out at the top. Most people do complete the longer application, and it's to find out if they can qualify for any savings. So what that application does, it takes into consideration your entire household and all your household, meaning your tax dependents in your household. So if it's you and a spouse and you file taxes together, that's your tax filing household. But if you have your spouse and one dependent, the three of you are that's your tax filing household. So we take this information into account to see if in fact you qualify based on your annual projected income, if you could in fact qualify for any savings. The amounts that we were talking about, that someone could qualify for a $0 plan or something as low as $264, that's only if somebody qualifies for Connector Care. And I'm just going to ask Aaliyah if she can share the link to the Connector Care income eligibility requirements. And that's why you would be, some people, yes, if you don't know if you have a family plan, yep, sounds like you have a family plan, and it's over $800 per month. So again, it really is we take into consideration the entire tax filing household when estimating the costs. I hope that helped to answer the question. We have another question about composition. Nina, I'm going to look to you. And it says, for the 50 to 33%, can you explain how that requirement is calculated? So let's say for a family of 4, so a spouse and 2 kids. Is that so? If you're the employer, I think this is how I'm understanding. If you're the employer and you're trying to determine how do you figure out what your contribution is going to be for that employer in their family? Can you just explain that a little bit more?
So the system does calculate the rates based on the product that you choose. So for one plan, again, it is a composite bill format. And so then it's broken down for employee only, employee spouse, employee plus dependent, and then also family. And then for uh, choice choice model, it is based on the composite format for the rates. Once those employees enroll, based on the reference plan that you've selected, you're contributing towards that reference plan. So for one plan, it's just that one plan option, but for the choice model, you're still paying towards the reference plan and the employees either buy up or buy down based on what is being offered to them. But it does not increase your cost as the employer for that plan.
Okay, great. That's super helpful. Now, can you explain this again, but in your own words? If a spouse works for a company, are they eligible for the insurance? So you've got Health Connector for Business, you have multiple people working there, but it also happens to be two partners, a married couple.
Yes.
Are they eligible for the insurance? So can you just talk about that a little bit?
Yeah, so even owners are eligible to enroll into coverage as well. The only thing is we just don't count them when determining the size of the business and also for the participation requirements. But yes, absolutely, the spouse can enroll. If you have a dependent or a child working for the business, they can enroll into coverage as well, but we just don't count them when trying to determine the size of the group.
Okay, great. Great, great, great. See, I feel so good. I knew people would come up with more questions.
Mhm.
All right, folks, we have a couple more minutes left. Anything else you need before we wrap up today? We will certainly wait to see if anyone types in any more questions. So Leah, I'm not sure if you can flash on the screen where excuse me, the customer service numbers one last time for folks. But just know that if you do need any help, if you think of a question after, after the fact later on today, don't hesitate to call the Health Connector for Business customer service number. Oh, one last question. If there's a non-dependent child who is over 23, do they count as an employee?
Yes. So as long as the owner is not actually, they're not claiming as this child as a dependent on their individual tax return, then yes, this dependent, well, we wouldn't even call them a dependent, but they would be considered an employee of the business as long as they're W-2, and again, they claim their wages based on the federal and state tax requirements.
Great. All right. Thanks so much. All right. I'm going to give everyone a couple of minutes of time back in their day. But again, we're so appreciative that you were able to take time out of your day, join us for this educational session. And certainly if you need any assistance, do call customer service and they can help direct you to the right location for more help. Thank you to Nina for answering all of these questions, the Leah for all your support, your presentation, and Kathy as well for all the support behind the scenes. Thank you, everyone. Have a great day. And again, thank you for joining us for today's Health Connector for Business presentation.
Thank you, everyone.